Welcome again, everyone, and thank you for joining NCBA as we host a webinar on identifying what matters, my health priorities, in partnership with the My Health Priorities program. Our presenter today is Kizzy Hernandez Bigos. Kizzy is a dedicated health priorities identification facilitator and trainer at the Yale School of Medicine, Department of Internal Medicine, Geriatrics. She brings a deep commitment to person-centered care with a special focus on supporting older adults through complex health conversations and care planning. Kizzy holds a Bachelor of Art in Psychology and Applied Social Relations from Eastern Connecticut State University. She is certified in mental health first aid for older adults and is a certified train the trainer for providing serious illness or end of life conversations. Kizzy, thank you for joining us today. We are so glad to have you, and the floor is yours.
The pleasure is all mine. Thank you so much to everyone for having me today. I am excited to share this with you, and I certainly hope that it resonates. Identifying what matters most, my health priorities. First, we'd like to just show you a little bit of background information and an overview. We're going to talk today about patient priorities care, which is the umbrella to which My Health Priorities was derived. We're going to talk about My Health Priorities, and then we're going to talk about why it's important for someone to identify their health priorities. Patient priorities care is an approach to healthcare decision-making, and it was co-developed by Dr. Mary Tanetti at the Yale School of Medicine and Dr. Anand Nayak at the University of Texas, Houston. We are funded by the John A. Hartford Foundation. Our mission is to reach as many older adults as possible to help them identify their priorities so their care, services, and supports can align with what matters most to them. The 4Ms. I'm not sure if you're familiar with the Institute for Healthcare Improvement. They have a healthcare initiative called the 4Ms to ensure that the delivery of care for older adults meets the best practice with the non-harm. And they have created a 4M curriculum: medication, mentation, mobility, and matters most. And patient priorities care meets the M under matters most, and we strongly feel that understanding what matters most to someone can help address the other M's. We'd like you to think about some questions throughout this presentation. Have you ever been asked what matters most to you in a healthcare visit? If you could please put your responses in the chat, we would appreciate it. Patient priorities aligned care. There's really two main components to this work. One is identifying your health priorities, and the second is understanding what to do now that we know what matters most to a person and how we can align the care we receive, the services and supports we receive, knowing what matters most. The parts of identifying health priorities include a value, which is what matters most to you. And then we try and create a way to act on what matters most through what's called a health priorities goal or a health outcome goal. We want that to be specific and realistic, but we also want it to have meaning and be based on a value.
Is it?
Yes.
Hi, yes. So we have, as you asked, we have about 10 no's and 2 yeses.
Oh,
So
thank you so much.
consensus is no.
Hmm, that's wonderful to know. And thank you for sharing. Then we ask a little bit about the care preferences. So your actual perspective on the care and support that you receive. And if you find it helpful, or if you truly wonder if some of the care you're receiving are making things more difficult and have created some burden, or that you even have questions about whether or not it's helping you do more of what matters. And then we take that information and we put it into a one thing or a top priority. We know that every aspect is important to you, but it's a place to start so that in those busy healthcare visits, we have a place to act. But those are the pieces of identifying your health priorities and that are hopefully going to guide conversations in the future. Another question for you. Do you have a health priority goal that you are working towards? And if you do, and if you're willing to share it with us, would you kindly enter it into the chat? Thank you. There are two ways to identify health priorities. One is through a health priorities identification quick guide, which is a paper version of my health priorities, because we do understand that sometimes not only is there limited access to computers, but sometimes there's a limited ability to use computers for various reasons. So we wanted to make sure that there was a downloadable paper version for people. And then My Health Priorities, the website that takes you through identifying your health priorities, is a website to guide older adults and care partners welcomed to identify their health priorities and understand what matters most to each person and what care preferences they have. It is completely free and open access for individuals. It produces a summary of a person's health priorities based on the responses provided, and it provides conversation tips for when talking with your healthcare teams and community supports. We wanted to show you the paper version, and it has areas to write. It has prompting questions to help you consider how you choose to answer these questions. In identifying what matters most to you, it has some really great prompting questions. In setting your health priorities goal, it helps take you through that process, just as the website would. This is page 2 that continues with your care preferences and then helping you formulate a one thing or a top priority to focus on. And the direct link for this will be provided to you in the chat. We'd like to introduce you to Mrs. K. Mrs. K is 75 years old. She has diabetes, arthritis, she has urinary frequency, she has some depression, she has some anxiety, she has sleep apnea. She has difficulty affording public transportation and medications and healthy foods. We're trying to manage her work, her volunteering, her social and medical needs, and every change and additional appointment seems to overwhelm Mrs. K. Also, she's widowed. She lives alone. She has 2 daughters. One lives out of state. And again, difficulty covering her deductible, her copays, transportation. She tries to spend as much time as possible with grandchildren that live in the state. Mrs. K's health priorities. So we took Mrs. K through this process, and she truly values spending time with her family and having a sense of purpose through her work and volunteering. How she chooses to live out this value is she wants to be able to watch her grandchildren 2 to 3 times a week. The things that she finds helpful in her care is exercise, oops, excuse me, physical therapy, tests and imaging. Some of her medications she finds tolerated and helpful. And then the burdensome care, we have her CPAP machine, some of her medications, and going to the hospital. These are things that she actually finds get in the way of her doing more of what matters. And what she finds is most bothersome currently is her tiredness and her pain. So, her top priority, the thing she wants to focus on, is to have less pain and tiredness so that she can watch her grandchildren 2 to 3 times a week. We want to consider what matters to her before we start making recommendations and talking about next steps. But now knowing the things that matter to Mrs. K, we're going to suggest that we start with either adding physical therapy to improve mobility or adding occupational therapy to go over a daily routine that includes practicing conserving energy while completing tasks, or both. We have other options for later, and then we want to know what Mrs. K thinks. And a second way to communicate is recognizing the trade-offs that she's been facing, having to balance the tiredness and maybe not wanting to try some recommendations. I know you don't like the CPAP, but are you willing to try it for 2 weeks if it were to help you truly be less tired so that you could watch your grandkids and go places easier? We want to make sure that everyone can make the connection in a way that's meaningful to them between the care and recommendations that are out there and what matters to this person. When care and services are aligned with health priorities, the individual feels heard, engaged, and motivated, which increases adherence and our understanding of why. It offers a focus when sometimes there isn't one best answer. It helps us achieve patients' health priorities and helps that become the measure for the care and treatments that we want to provide. Is it truly helping you do more of what matters? What is this all in service of? And it directs whole healthcare teams and community service professionals to the same target. My Health Priorities is the website that includes this process that we've been talking about today. Just to give you a little bit of the technical aspects, there's a sign-in option. You can continue as a guest, or you can actually create an account to make sure you can save your progress and go back. And the guided questions include the categories we talked about: what matters most, which is what a person truly values, their health outcome or health priority goal, their bothersome problems, the current care that they find helpful, their top priority, and it goes over then taking that summary and sharing it with others. This is the home page currently for My Health Priorities, just to let you know a little bit of what to expect if you choose to go through it in this way. It has a brief explainer of what they're going to ask you about. It lets you know that when you're finished, you'll have a printable health summary. It lets you know that there's an absolute privacy aspect to this and the approximate time it can take. But it all depends on the individual and how long they want to spend on their responses. So it is a very intuitive process it takes you through, but it helps you truly take those things that matter to you and put them in a way that hopefully your teams can act on. Here is a sample of the summary that you will receive after. And this one is based on Ms. K and what we learned from her. So this would be her summary. And I just want to make note of what's at the bottom where it says healthcare professionals in a very small print at the bottom. But it's letting whoever you show this to be directed to where they may want to learn more about this, about patient priorities care and my health priorities. And we also have the tips on having conversations with healthcare teams. So here we have a screen that's embedded in My Health Priorities, and it is tips for talking with your healthcare team. We want to let your healthcare team know what your goals are, your symptoms, what's helpful for you, and what's burdensome. Show them your summary as a first step. Ask for help to meet your health outcome goal. For example, is there something that will help me with my goal to walk around my house without being so short of breath? Ask if treatments will help you with your goal. For example, will this medicine help my energy in the morning so that I can walk my dog? Would this treatment improve my shortness of breath enough to get to lunch with my friends every day, the things that matter to me? And then it's that directness. What's expected with treatment and effort would be. For example, what exactly do I have to do on my own if we start insulin? Because it's those pieces and those tasks that matter. Be specific. For example, instead of saying, I don't like this medicine, say, this medicine makes me feel weak and dizzy, and I can't get out to visit or see my friends and family. We hope that's helpful in your conversations, and the summary can really be a catalyst and a guide for that. Final question for this presentation. Now, having learned more about health priorities, do you think differently about your health priority goal that you had stated in the beginning you possibly were working towards?
The yeses are having the eye, Kizzy. Lots
Thank
of
you so much.
yeses. Yeah, that's what we want. Yes.
Absolutely. I want to thank you so much, and I'm looking forward to answering questions and certainly reviewing your responses. And thank you for taking the time, of course, to do that. As a part of this presentation, we wanted to provide you, of course, with resources. Of course, the quick guide, My Health Priorities, our main hub website, Patient Priorities Care, the toolkits for health professionals, and stay tuned. We now will be creating a toolkit for community professionals. The training that we have, which is also free, if anyone ever wanted to actually join a training for patient priorities care, it's a 6-week, held twice a year, 6-week course, and it's all virtual. And we also have a newsletter that we would welcome anyone to try and to sign up for so that if they ever wanted to keep up to date with patient priorities care. And
Thank
at
you.
this time,
Thank you, Kizzy. Thank you. What an awesome presentation. And thank you very much. I thought I might share my health priorities with my dad, but I decided to take the training myself as a caregiver, and I'd like to encourage any caregiver who's joined us this afternoon to do so. I learned a little bit about myself and my health priorities, and one of them, before we jump into Q&A, for myself is to go back to the gym. I enjoy my friends at the gym. Social engagement is important to me, not just for the physical aspects of being in the gym, but I like my friends. And so my health priorities really help shine a light on, okay, I've got to get back into the gym. But enough about me, and I'd like to take this time to ask our audience to please put your questions in the chat. And as we wait for those questions, Kizzy, I have a few questions if I might ask you. Um,
Please.
one of the things that resonated with me is that my healthcare provider, and I'm sure many of our healthcare teams, are seem like they're always hurried. They come in, they greet us, they put a stethoscope on our chest, they ask a few questions, and they're gone.
Mhm.
How do we set them down just for a few minutes to share our summaries with them, to let them know that we are engaged and we want to accomplish these health goals, but we
Mm.
need a little help in doing so. Do we send our summaries ahead of time, as many of them ask us to fill out a whole host of paperwork, or do we wait until we get in front of that clinician's face and we share our summaries with them? What's your thought on that?
That's a great question. I I think I would send it ahead of time because it can't hurt. And if there's some preparedness, because I think you bring up a great point that it's not only on the part of the person, but a space needs to be created to invite this type of conversation. And a lot of times there's a dynamic that just is already there. I'm going in, this person is in charge of the numbers. They know what the numbers are, they know what they mean, they know what they're supposed to be giving me. But what we're trying to let them know is those numbers affect me. And what you choose to give me to treat those also can affect me in ways that maybe you didn't consider.
Okay, thank you.
And having the one thing ready, if they truly did not want to look through the whole summary, your top priority matters because it's why you walked in today. The only reason you're there and what this care is truly in service of is what matters to you. So that's what we want to convey more than anything.
Okay, thank you for that. And to build on that a little bit, are we sharing our health summary with all of our healthcare providers? And even some
Abs-
that might be, like a dentist or maybe a podiatrist, those that we may not consider our doctor. Are we sharing our priorities with those clinicians?
Absolutely. And thank you for bringing that up. They work towards your quality of life as well.
Yes, they
I
do.
mean, we know the impact of those specialty kind of care visits can have on us, even though it may not seem as large, it matters. And even from symptoms. But the other piece is back in the original pilot, we worked not only with a primary care practice, we worked with a cardiologist office that were in partnership, and it actually got them to communicate more to focus their care on the same goal. So we did share health summaries with both pieces, with both parties, and they actually thought differently about the recommendation that they made because now knowing what mattered to the person, maybe treatments needed to be tailored a little differently.
Oh, that's wonderful. Okay, thank you. And I'm checking the chat here and also like to encourage our audience to ask those questions while we have Kizzy. Thank you again, Kizzy. I have another question. I have 10 questions here that so, but I don't want to dominate the conversation. So please share your questions with us. I also noticed that goal setting wasn't traditional SMART goal setting,
Mhm.
and that there was no T there for time-bound goals. As many of us have been taught, it's a SMART acronym: specific, measurable, actionable, realistic, time-bound.
That's a great catch. And so important. We talk about function and health and what we're able and willing to do. And as our function and our health can change moment to moment, we leave off the T.
Uh,
because we can't always put a time on the things we can't control. Because my life could change 5 minutes from now when I leave this conversation and walk to the curb out to my car, and we want to make sure that the goal is realistic, it's actionable and specific, but most importantly, that it has meaning. We're used to clinical goals. We want to lower A1C. We want to have less pain. We want to lose weight. But what we want to know is, what would you be doing more of if you had less pain? What would you truly be doing more of if you weren't feeling as dizzy? We know that those matter, but what we want to get is to where you're having a life of meaning, and we need the care you receive to help you do that.
Thank you for saying that. That also takes some of the pressure off. A lot of us, myself included, we um, put, especially with time-bound goals, and if we don't achieve those goals, we put a lot of pressure on ourselves. If I don't make it to the gym today, I won't lose weight. Well, perhaps what I learned from this module, if I take a walk, it might be just as enjoyable as going to the gym. So thank you very much for that. We've got a question here in the chat, and I'd like to read it, if I may. It says, is there communication assistance for older adults with sensory disabilities to use the program?
That's a great question. We are working actually with a care model called PACE. It's called Program All Inclusive for the Elderly, and it's a separate model. But what was brought to light was the different populations, and a lot of them were nonverbal, and sometimes moderate to advanced dementia. So what we did was we came up with some conversation pieces. So it may not be the best fit for them to go through my health priorities, but that's where the 2-page document and how you frame those questions. And maybe you do have to, if the person identifies a trusted care partner, talk a little bit about how this person lights up during the day. What if something weren't happening? How would we know that they're not having a good day? It's really wanting to build on their strengths to better understand what's important to them.
Okay, thank you, Kizzy. We have another question, and it asks, is My Health Priorities available in Spanish?
It is. It is
Okay,
on the website. So thank you. I can follow up with that direct link.
okay, and in other languages as well?
Right now it's done in Spanish, but I believe on My Health Priorities there is the standardized Google Translate.
Okay,
So
okay.
that globe that you can
Okay, thank you very much. We have another question, and it asks, what advice would you give patients whose care team may not be as willing to incorporate their health goals and priority summary?
I think I would try and champion the fact that these are your wishes and this is your visit. Your visit, and what matters to you is why you even want to be healthy. The care and treatment that you receive matters to you because you want a quality of life and a meaningful tomorrow and the next day. So making the connection between the two is imperative. You're not going to take a recommendation that's going to keep you from a quality of life. And that conversation is important to have. Your priorities matter, and they should help guide the conversation and decision making.
Okay, thank you for that. I want to go back a little bit and speak to my goal setting here. I know there's no M in the goal setting, but how would one measure um, success or challenges with achieving priority health? How would they do that? And then the follow up is, how would I measure success?
This is how the conversation shifts. Knowing from a person, were you able to do this goal that you set? And if the person was not able to do it, what we would want to know is what aspects of it can we then work on?
Hmm.
Where can we start? Because this goal is based on a value. It's based on what's truly meaningful to the person. And we know that health and function can change. And since they can change and they're out of our control, measuring now by what a person is able and willing to do that has meaning is how we want to continue to measure progress moving forward. This is the new measurement that we
Thank,
should be using.
thank you very much for that. I appreciate that very much. We have a question in the chat and it asks, how can this tool be used by my 92-year-old mother who's nearing the end of life?
Hmm. We actually just did this with a 92-year-old, similar situation. And we actually had what was called guided. So the two-page document, having a conversation around what matters to you, but there was a little bit more of a focus this time because of the end of life for this person on the symptom piece. Are you suffering at all? Are there
Hmm.
areas you feel we could be doing better with? What truly is going to bring you joy? It's really focusing on those questions. This is where we differentiate ourselves from advanced care planning versus we call ourselves current care planning.
Oh, I
We
love
want
that.
to know how today is going to be better. And I think this is where they mesh beautifully because it can be used for those nearing end of life conversations because today is so precious.
Thank you very much. I love that. Kizzy, you spoke to when we spoke to the T, what why goals aren't time bound because we know that life can change, right? So since that life, because life can change, should we go back and revisit my health priorities often, or if we get sidetracked off of that goal for whatever reason, should we go back and we revisit my health priorities again and generate another summary?
That's a great question, and it's been asked by pretty much every primary care practice that we work with, and we're national. Yes, they automatically put in a revisit at ideally at every visit, but
Wow.
they will make sure to standardize it to maybe your annual wellness visits or your every 6 months. But yes, because things certainly can have changed. But what doesn't change is what truly matters. It's how we choose to carry that out that can vary depending on what we're able and willing to do.
Oh, that's lovely. Thank you very much. We have another question, and it asks, how may older adults access the quick guide and the other resources if their computer literacy is limited, or if they reside in a rural area with limited internet access?
That's a great question. It is why we have the paper version, but you still bring up a great point. How do I get to this paper version? Um, you can reach out to the general website of Patient Priorities Care and ask for paper versions to be sent out, mailed out, if that would be helpful.
Okay.
But yes, I don't, and I agree with you. That was the purpose of making sure we had a guide. Um, but sometimes there's limitations on that too, with accessing that guide initially. We have started a project with libraries
Oh,
to see if we can have some sort of visual pieces there so that they learn more about this. And sometimes it's a standard, but in your rural communities, we have to work within this.
okay. And are we limited to the number of times that we can request a guide?
No, no.
Okay, okay, that's wonderful. We have a question and it asks, can I fill out my health priorities on my daughter's iPhone? I love that.
So it just became available, I think, within the last few weeks, mobile friendly. It is not as picturesque as the larger one, but it can be done on iPhones.
Okay, that's great.
Yeah.
Okay. And then we have another, it asks, other than the website, does My Health Priorities have My Priorities Care have a state or region-wide assistance locator?
It's a great question. I don't believe it comes up yet as a part of Elder Care Locator or your 211. So I think that's how I'm hearing the question. We're really, because honestly, letting me speak with you today is a part of our dissemination, our trying to get the word out and reach as many people. I don't think, I know we have our website, we're trying to do broader reach, but it's a great question. I don't know if I have the best answer for that. I hope we are able to be found pretty readily, but I'm not sure if we're a part of the elder care locator yet.
Okay. And then the next question asks, if I t participate in My Health Priorities, is my personal information covered by HIPAA?
So when you go to the website, there's an entire privacy tab. You want to create your own account. It is completely private. No one can ever see your personal information. The most that gets done on the back end are numbers. Did an individual fill this out to page one, page two, page three? They're never privy to your personal information. But you can certainly read through the privacy aspects, which we link to on the homepage.
And again, there is no cost um to participate in this program.
Not at all. Anyone can go on it right now and just start doing it. Free
And
and
that's
open
no
access.
age restriction, or is it solely
Um,
for no age restriction?
Great question. We have learned that this is certainly for everyone, but it was designed originally to help older adults with multiple chronic conditions, getting a lot of competing recommendations because of possibly so many different specialties needed. We wanted someone to be able to not lose their voice in all of the different things that needed to be helped.
Okay, and thank you for that. And I want to add that I don't have multiple conditions, and I was able to participate. And I really appreciate the module having a component for me to hit next. And so I appreciate that very much. And again, as a caregiver, it was very enlightening to see that I had some health priorities that meant something to me beyond my caregiving responsibility. So, again, I'd like to encourage all of my caregivers out there to take a look. Your priorities, your health priorities still do matter, even in the throes of caregiving, and you still can achieve them. And so, again, I want to thank Kizzy and for sharing this with us. Let's see what's going on in the chat here. Okay, we've asked about the iPhone. Um, I'm going to ask any more questions. Well, Kizzy, here we go. Great. After after completing the module, how long does it take for the summary to be sent to the client?
Great question. After you answer the final question, it populates immediately.
It does. And it's great to hang wherever you post things in your home. I have a bulletin. It was nice to have my summary, something to look at. It really is a nice tool, very easy to go through. And so I encourage everyone to check it out. It only takes a few minutes and it's really, really thoughtful. And so, Kizzy, I want to, as we wait for the next question to come, I want to ask a question. If I did ask this, about outcomes.
Okay.
Outcomes. Again, can you speak to just a little bit more? How do I know if I'm really just, hitting my goal? How do I know?
Think it's up to the individual if they feel they're doing what truly matters to them.
Okay, what truly
And
matters.
it'll also help them see, is there something that's getting in the way of me doing more of what matters?
Okay. And I think you said something that is really important, that it's okay to acknowledge that there might be something getting in the way. I think that's
We
important.
know that everything that's recommended is for a purpose, and we're not questioning that. We just need to know, is it going to help me do more of what matters to me?
Okay. We have great question. What if I don't have a printer? Can I save the summary somewhere?
This is where I would encourage you to create an account. So
Ah,
you have the choice to go through it quickly as a guest, which I do believe one of the most recent improvements might have allowed you to save that. But creating an account is your own personal account to guarantee that you can save it and go back to it at any time.
okay. And I think you might have covered this, Kizzy, but if I may, if someone doesn't have access to technology of any kind and they were to call your organization, is your organization can they send hard copies via US mail to someone? Is that doable?
You know, I would love to be able to get back to you on that
Okay,
question, a little bit about the process, because it's a great question, and I know that's why they created the downloadable version. But again, it's that lack of access to what if we're unable to download. So I would love to be able to get back to you with more specifics on that.
okay. Thank you very much.
Mhm.
And looking toward the chat. I don't want to dominate the conversation here. Okay. Well, as we wait for questions to come in, you mentioned libraries. Now, is this module in libraries now? Is it forthcoming? And in addition to libraries, might we see it in faith-based settings, hospital settings, as we, as we go, as we enter maybe a hospital setting or a clinic. Any thoughts about that?
In On our website, we do have a map that shows all of the places we've been embedded across nationally, and a lot of them include clinics, hospitals. Um, but I think the beauty of My Health Priorities is that we can do it on our own and bring this to them. And it also provides the healthcare team or the person you're seeing where to get more information if by chance they haven't heard of this before. But yes, we have a lot of partners across the country
Okay.
that are helping us disseminate this work and look at it differently because things change, and how can we keep growing and making this better?
Well, Kizzy, I think that was a perfect segue to saying thank you. Things do change. Our world is changing every day. But as you say, and I want to build my priorities on it, we want to make things get better. And this module, I believe, will help me achieve that goal. And I love the fact that I am not um, tied to a time-bound goal. If I, for myself, I figured out if I don't get to a physical gym to socialize with my friends, because socialization is at the core of what matters to me, I can take a walk with a friend and still achieve what matters to me. So again, I want to thank you very much for sharing this module with us at NCBA and our audience. I'd like to encourage everybody just to take a few minutes out of your day to log on and to learn, if you don't already know, or to reaffirm what matters to you. Kizzy, we hope that this is not a one-off. I'd like to welcome you back. This is a
Thank you.
conversation that needs a lot of um, revisiting because our lives change all the time. And so, again, I want to thank you. And before I sign off, someone just snuck a question in. So I just I want to share this question. It says, how do I get involved for my own health priorities and spread the information?
Um, if you would be willing, I would be happy to share my email if you wanted to contact Angie and Angela. I would be happy to talk with you more about sharing this information.
Okay. And we'd ask that the person who asked the question to email us and we will connect you all.
Thank
We're
you so
happy to do
much.
so. Okay, thank you, Angela. Okay, well, Kizzy, thank you very much for sharing My Health Priorities Matter with us this afternoon. Thank you to our audience. We appreciate you joining us. We look forward to seeing you very soon.
Thank you so much for this space, for this time. And I just appreciate how thoughtful and amazing everyone has been. I'm
Thank
happy
you.
to share this.
Thank you. We're happy to have you, and we'll give you back your afternoon.
Have a great day.
Have a great day. Thank you.
Bye bye.